Mr Deputy Speaker, I rise today to contribute to this matter of public importance on the investment in the health sector in the Northern Territory. And Mr Deputy Speaker, it breaks my heart, straight from the Leader of the Opposition's mouth. They represent 4 of the most marginal electorates in the country with terrible, terrible health outcomes, and all 4 of them, Mr Deputy Speaker, who are now sitting in opposition alone, they represented these seats under a Labor government. And Mr Deputy Speaker, I apologise for misgendering you, they for 4 years, for 8 years, for 2 years or 3 years, if I remember that correctly, they sat in power, in government, and they did not deliver for their own constituents. And Mr Deputy Speaker, I can't understand how we've had a Labor government for 19 of the last 23 years, and they're going to get up and say that the CLP government 8 months in isn't doing enough to close the gap. Mr Deputy Speaker, 19 of the last 23 years, and it breaks my heart that they're now going to get up and spout federal politics. They're going to say, how great is Anthony Albanese for his $150 power cuts and his slightly cheaper Medicare rebates, while he's doing absolutely nothing to help the poor health outcomes we have in the Territory. And Mr Deputy Speaker, I hear it when I talk to the member for Daly's constituents. They reach out to me and they say, what are we doing about Dundee? What are we doing about health services out towards the Daly? And it breaks my heart to know that he was in government. He was the Speaker at one point, Mr Deputy Speaker, and yet he could not achieve anything for his electorate. The member for Arnhem, the opposition leader now, she was a senior minister under Michael Gunner and Natasha Files and Eva Lawler. And what did she achieve health outcomes for her electorate? It honestly astounds me that they will come into this place tonight and go, the CLP government after 8 months has no vision for health. Yet, Mr Deputy Speaker, they're interjecting now because they don't like to hear the truth. They failed their own constituents, Mr Deputy Speaker. We're going to get up and we're going to talk life expectancies.
Order. Let the member for 𝙗𝙗 be heard in silence, please.
19 of the last 20...
Sorry.
I believe the time is now expired.
No, there's still time.
The clock never started for my speaking. Top left, 2 minutes 23.
On the global time.
2 minutes 20 seconds.
Yeah.
I appreciate the member for Arnhem, the opposition leader's attention to detail, but I just wish she paid some of that attention to the constituents in her electorate who she could have improved the lives for, Mr Deputy Speaker. She could have genuinely made a difference in this place, and it's terrible.
Leader of the Opposition,
Mr Deputy Speaker, I am passionate about...
Order. Yes, can we cease the interjection? Let the member for 𝙗𝙗 be heard in silence. Everyone else was heard in silence. Thank you.
Mr Deputy Speaker, if the Leader of the Opposition had done some research, you'd know I'm quite passionate, especially around the Tiwi Islands, and I'm quite passionate what's happening out towards the Daly River, what's happening out at 𝙗𝙗. I want to make the Territory a better place, Mr Deputy Speaker, and I understand the best way to long-term look at reducing crime in the Northern Territory is to make sure we do invest in our communities, Mr Deputy Speaker. If we can turn it around, we can make them great places to live, we'll have a lot less transient population and a lot less issues. But right now, Mr Deputy Speaker, after 19 of the last 23 years, they're going to get up and say in 7 months we haven't done enough to close the gap. What did you achieve in 19 of the last 23 years? 8 years as a senior minister under 3 chief ministers, and yet they had the audacity to come in here today and say the CLP is all about cuts and the CLP is going to do this. Why didn't you invest? You spent billions of dollars you didn't have. Why didn't you put it into health? Why? I don't understand how we got here today, where all of a sudden they're going to rewrite history. They've got some federal talking points from Anthony Albanese, and they attack Peter Dutton in their speech, Mr Deputy Speaker. Their priorities are completely and utterly wrong, and if they had spent any of their time in this chamber and in the meetings and in the cabinet looking after their constituents, they wouldn't be here tonight saying, oh, poor us, poor us. Why didn't you invest? I can't understand. I don't understand. Why would you fail your own constituents? They're the people who voted for you, or at least the 30% of them that vote. But why on earth can you look yourself in the mirror tonight and think, I did a good job, I raised an important matter, though I failed them for 8 years?
John. Thank you.
We also had a MPI this afternoon on the NT government's healthcare, and I added a contribution to that. It was ridiculous that the opposition got up and they said that the Northern Territory government's not doing enough to close the gap, and they're not doing enough to invest in healthcare, especially in the regions, when you've got four members of parliament who are all part of a Labor government for a number of years now, including Leader of the Opposition, who was a health minister, who failed to invest in the communities and failed to deliver for Territorians. We've had 19 of the last 23 years with Labor government in the Territory, and they're going to say that the CLP government in the last 8 months hasn't done enough to close the gap. It was just ridiculous, the whole premise there. But it was basically a puff piece for the federal Labor. They spent more time talking about Peter Dutton than they did about Territorians. It was ridiculous.